So today we'll be discussing about the low risk and the high risk of the pregnant lady and their antenatal care. So it's a multidisciplinary approach has been discussed previously. I've already discussed regarding the previous slides. So antenatal care definition is important and followed by what do you mean by low risk, what do you mean by high risk. Today we'll be discussing about the antenatal care of both low risk and the high risk. So now I'm starting the definition of the antenatal care and what the important care to be taken for the pregnant lady who is a low risk, then followed by the similarly high risk. So the definition of the antenatal care normally the periodic and the regular supervision, including the examination and advice of a woman during pregnancy is called antenatal care. Previously, it was only the examination followed by the advice. Now the term is changed. It's a periodic. When to come, when not to come. When to have, when not to have. Regular supervision. Regular supervision, what is going on in this 9 months of pregnancy, starting to the last, which includes the examination and the advice. The supervision should be of a regular and the periodic nature in accordance. So what is the importance of supervision? Is it only seeing the patient vitals? Is then giving the advice? No. The supervision should be of a regular. Means we have to see this patient is a normal patient or an abnormal patient. If it is a normal patient, what is the important care to be given? If it is an abnormal patient that is in high risk, then what the important task to be evaluated, then it should be explained to the patient clearly. And it's in a periodic nature in accordance with the need of the individual. Means antenatal care is a care to be given for the single patient, not all the patient. Like 60 patients coming to our OP, we are not giving the same advice, we are not going for the same supervision. It varies with the individual. So the aims means if you are doing any work, there will be some aim, then there will be some objectives. The aims of the antenatal care are to screen the high risk cases. And if we are taking the 100 patients, in that 100 patients, we have seen that patients. So the aims which I was discussing is to screen the high risk cases, to prevent or detect to treat an early complication, to ensure continued medical surveillance and the prophylaxis, to educate the mother about the physiology of the pregnancy and the labor by demonstrations, by chart, by diagrams, so that the fear is removed and the physiology is improved. And is nothing but out of this some patients being selected. For that we have to separate this a low risk and a high risk. Then after separating the to low risk and the high risk, then we are determining what the patient need care, what patient evaluation is needed from that in order to prevent the early complication. Next, to need a important medical surveillance means what medical lab examination is needed, what minimal invasive techniques is needed for that patient. And the prophylaxis nothing but we give the what you call anemia prophylaxis. We'll give the what you call prophylaxis for the iris cases like a preeclampsia, high-risk pregnancies, other high-risk pregnancies. I'm giving an example like RH negative will be the prophylaxis anti-D example, right? So to educate the mother about the physiology of the pregnancy is nothing but like patient was not pregnant before, she don't know anything, then she'll be having anxiety, she'll be having some doubts. So in order to give a clear-cut idea, every patient is counseled. What is pregnancy? The 9 months duration, then what will happen in the first 3 months, what will happen in the next 6 months, what will happen at the end of the ninth month, then followed by the importance of the pains during the labor, before the labor, and what the importance of the baby means gestational age. Depending upon the gestational age will explain the patient very clearly ki what the care is needed for you, not to worry anything, these medications to be taken, these investigations to be taken, this is the basic thing. Then at the end, labor, what do you mean by labor, we have to explain very clearly for the patient attender also, not the patient attender is also important to counsel the labor, what the importance of labor, what do you mean by labor, true labor pains, fast labor pains, normal labor, when it's to be done, when it's called abnormal labor, it to be explained very clearly. Then it should be on a pictorial graphical representation. It should be on a pictorial graphical representation and the patient anxiety to be removed. That is more important. This is the aims of antenatal care, both low risk as well as the high risk. So to discuss the couple about the place, time and mode of the delivery. And after the 9 months, when the patient is going to terminate, it should be explained to the husband and it should be explained to the mother kid, now she's going to deliver the baby, and after the delivery, what the care to be given to the newborn. This is a important aim to explain the patient, including husband, to motivate the couple about the need of the family planning. Then afterwards, after termination of the baby, family planning is nothing but contraception. What contraception should mother use for 6 weeks? This is so much important. It's play a vital role for the perperium, that is after the delivery, then followed by to improve the postpartum care and to prevent the postpartum depression, postpartum anxiety, and postpartum psychosis. This is important step to be taken by the doctor to explain the couple, both husband and wife. This is an important aim of the antenatal care. To advise the mother about breastfeeding, postnatal care, and the immunization. As I've discussed earlier about the planning that is called family planning, it comes under the postnatal care. So to advise the mother about breastfeeding means after the delivery, means routinely we are following half an hour after the normal delivery, 1 hour after the cesarean section. In some places, they are following 45 minutes, but ideally speaking, half an hour after the normal delivery, then 1 hour after the cesarean section, breastfeed. Exclusively 6 months breastfeeding is required. No other extra top feeds is required for the baby after the delivery. It should be explained to the mother very clearly. Then the postnatal care is important. Postnatal care. Postnatal care is nothing but the care after the delivery of the baby till the 6 weeks, where the baby will be a late neonate. This is called postnatal care, and the immunization for the baby. When to immunize, what type of immunization is required, what type of vaccination is required to be explained to the mother very clearly. This is one of the aim of the antenatal care. Now, coming to the objectives of antenatal care. Now, why we are discussing about the antenatal care, the care given to the pregnant women is nothing but to ensure a normal pregnancy with the delivery of a healthy baby from a healthy mother. Yani, we have to prevent the complications in such a way that we must save a baby and we must save a mother. That is a objective of the antenatal care. So the criteria of a normal pregnancy. Now, what do you mean by the normal pregnancy? Synonym. Yeah. So delivery of a single baby in a good condition, term gestation with no maternal complication is synonym, is nothing but normal pregnancy. It differs from the abnormal pregnancy. Nothing but if the criteria is not suiting to this sentence, that is single baby in a good condition, term gestation with no maternal complication is a normal pregnancy. Now, according to WHO, what the services to be taken in an antenatal care? I'm talking about low risk. I'm not talking about high risk. So WHO now recommends at least 4 visits. That is first visit before the 16 weeks. Nothing but as early as diagnosed by the pregnancy. Second visit, it must mandatory between 24 to 28 weeks. Third visit around the 32 weeks. Fourth visit is the 36 weeks. This is the mandatory services given by the government of India, like a Janani Suraksha Yojana, along with the other programs to the mother. This is the important, what you can say, prenatal visits or services given by the doctor to the patient. That is low risk. I'm not talking about high risk. High risk, when I'll discuss about how many visits the patient requires.